Good morning, good afternoon, good evening, and welcome to this global launch of the Lancet Global Health series on urban design, transport and health. My name's Zoe Mullen and I'm the Editor-in-Chief of the Lancet Global Health. When I was thinking about this introduction, I started to look back at some of the cities that I've lived in or visited over the years and how they compared in terms of sheer livability. So starting with Bath in the UK, where I went to university, a compact city where you could get to pretty much anywhere you wanted to be, food shops, workplace, home, parks, within 20 minutes or so, either by walking, cycling, or on a public bus. Contrast that with the first city I lived in outside the UK, Winston-Salem in North Carolina, USA, a sprawling city where my nearest food shop was a 30-minute walk away via a 4-lane freeway with no pavement or sidewalk. Melbourne, Australia, a large, densely populated city with a highly efficient and affordable public transport system and a comprehensive network of cycle lanes and cycle hire schemes. Lagos, Nigeria, where the traffic is so terrible that it not only causes physical trauma on a daily basis, but mental trauma too. But what is it exactly that makes a healthy city? Do we have any empirical evidence? How do we measure it? How do we legislate for it? These are all questions tackled in this fascinating series of papers just published in the Lancet Global Health. I hope what you're about to hear will encourage you to go and explore them because they are extraordinarily rich and detailed. But for now, each lead author will take you through their paper in turn, and then we'll have a panel discussion with some key external stakeholders. Throughout the webinar, please add questions to either the series authors or the panelists using the Ask a Question feature, and we'll have a section at the end where we hope to be able to answer them. But for now, I will hand over to the series lead author, Professor Billy Giles-Corti. Over to you, Billy.
Thank you so much, Zoe, for that very kind introduction to the series. And on behalf of the Global Healthy and Sustainable City Indicators collaboration, I'd like to echo Zoe's very warm welcome to the launch of this second series on urban design, transport and health. I'd like to also thank Zoe and the Lancet Global Health team for all the support in getting the series up and running because it's been a major undertaking. And before I commence, I'd like to acknowledge the traditional owners on the unceded land we are meeting here in Melbourne and to acknowledge their elders past, present and emerging, and also the traditional owners in other parts of the world and across Australia where are the lands we are presenting today. So we took the view in this Lancet series that what gets measured gets done. And I'd like to acknowledge the co-authors of this paper because these were the people who responded to a call out that we put out in 2018 to invite people to work with us to provide a proof of concept that it was possible to benchmark and monitor cities to create health and well-being. And this first paper in the series reflects on our very first series that we published in 2016. Now, since we published the first series in 2016, the urgency to transition to healthy and sustainable cities has become palpable. We know that, for example, that cities are the powerhouse of the economy. They provide us access to employment, education, amenities and opportunities. And since 2008, more than half the world's population has lived in cities. But by 2050, the estimates are that 70% of the world's population are going to live in cities. Now, when cities are poorly planned, they do a number of things. They foster unhealthy and unsustainable lifestyles. And you can see that from the image here on the right and the sorts of things that Zoe was talking about when she introduced the series. They expose residents to environmental stressors, to traffic, to noise, to pollution, heat-on effects, and they are a major cause of biodiversity loss. And as a consequence, they widen inequities. Now, cities generate around 75% of global greenhouse gas emissions, energy-related emissions, and 75% of this is due to road transport. And it's important that high-income countries take note because we generate most of the CO2 emissions, and it's going to be the lower-income countries that will really suffer with climate change because they have insufficient infrastructure and resources to respond. Now, the first Lancet series, which we published in 2016, outlined a conceptual framework of the direct and indirect pathways through which city planning affects health. And I want to talk you through that. What we argued is that if we are concerned about health and well-being downstream in cities, we need to be thinking about the upstream determinants of this. The urban system policies upstream, that work together to create urban and transport planning interventions that create the interventions that encourage people to be active. So, for example, we included three regional planning interventions: planning destination accessibility, distribution of employment, demand management that restricts how people drive, how much people drive, by providing good public transport. And then there's 5 local urban design factors: the design of the street networks, the density of the housing, the distance to transit, whether that there's a diversity of housing and shops and services to people to walk to, and the desirability. Is it safe? Do people have public open space? Is it green and leafy? All these things are important, encourage people to be active in their communities. So it's these things we thought it was really important that we measure. Do we have the policies in place to deliver the cities that we want? And what's the experience on the ground? And in our first series, we proposed a set of policy indicators that would measure legislation, policies and investments. But we also included spatial indicators that will tell us something about the lived experience of people living on the ground in cities. Now, to do this, we had to recruit cities across the world, and I want to thank all of our over 80 collaborators in 25 cities, 19 countries and 6 continents who worked with us to create the Global Healthy and Sustainable City Indicators collaboration. We wanted to answer a number of key questions in this series, and our overall goal was to facilitate the development of a global system of these policy and spatial indicators, these upstream determinants of health. And we asked in this series, is it feasible to measure these policies in cities worldwide? And if so, do cities have the policies in place to deliver the healthy and sustainable cities that we say that we want and need? Are there thresholds for urban design and transport features that encourage active and sustainable lifestyles? And is it feasible to consistently measure spatial indicators for urban design and transport features telling us about the lived experience on the ground? And if it is possible, are there inequities in cities? But we also wanted to consider what next? What should we be doing next to create healthy and sustainable cities? Now, to answer the first question, I'd like to introduce our first speaker, Melanie Lowe, Dr. Melanie Lowe, Research Fellow in Urban Resilience and Innovation at the University of Melbourne. And she's going to be asking the first question: do we have the policies in place to deliver healthy and sustainable cities?
Thanks very much, Billy. So I'll be providing an overview of the first paper in this series, and I really want to acknowledge, first up, all of the co-authors of this paper who really made this international policy study possible. And I especially want to acknowledge and thank Deepti Adlakar, who co-led this study. So as Billy has discussed, city planning policies have the power to shape urban lifestyles and environmental exposures, and are therefore really crucial for health as well as the attainment of the UN Sustainable Development Goals. Existing indicator frameworks, including the Sustainable Development Goal indicators, they tend to focus on downstream outcomes rather than assessing the quality of policies which are more upstream. So to enable international comparisons between cities and also to guide city planning, we need to comprehensively as well as consistently assess city planning policies through a health lens. And we know that to promote health, policy should be aligned with evidence on health enhancing city planning, but they also need to have clear and specific actions that are linked to measurable and budgeted policy targets that enable that monitoring over time. So this study assessed city planning policies for 25 cities. 19 of those cities were in high-income countries and 6 were in middle-income countries. And we started with the fundamental question: do policy frameworks support creation of healthy and sustainable cities? We focused on analysing policies for the whole city or the majority of the metropolitan area, and included formal publicly available government policy documents. A leadership group initially recruited built environment and health scholars to participate in this study via the International Physical Activity and the Environment Network, and also conference presentations. And then that network of local collaborators collected policy data, which we were then able to use to assess and compare the availability, but importantly also the quality of policies across the included cities. And for our policy analysis, we developed measures for 9 indicators that were proposed in the 2016 Lancet Series. These indicators assessed policies related to a whole range of factors, so integrated transport and land use planning, air pollution controls in land use and transport systems, destination accessibility via public transport, the distribution of employment across the city, demand management, particularly car parking restrictions, design aspects including street connectivity, public open space, and pedestrian and cycling infrastructure provision and mode share, housing density to support walkability, distance to public transport, as well as transport infrastructure investment by mode. And really this was a proof of concept study where we were trying to see whether indicators, and in particular this set of indicators, could be used to comprehensively assess and compare city planning policies for diverse cities. And we found that policy frameworks varied substantially across the 25 cities in terms of overall policy scores for both policy availability and policy quality. So we see on this slide a selection of cities highlighting the diverse scores for policy presence and policy quality. Now, Belfast at the top there had a perfect score of 24 for policy coverage across the indicators and categories, followed by Valencia and Unst and Melbourne. For policy quality, again, Valencia and Belfast, as well as Graz, had relatively high scores in terms of being specific as well as measurable and consistent with evidence on planning healthy cities. Baltimore in the USA had a much lower quality score than other cities in high-income countries. In general, cities in middle-income countries tended to have the largest policy gaps as well as lower policy quality scores than high-income countries. Sao Paulo was a notable outlier or exception to this amongst the middle-income countries, with a policy framework that actually outperformed many cities in high-income countries, making it a really positive example. And as paper 3 in this series shows, Sao Paulo's policy strengths may be contributing to better outcomes on the ground compared with some other lower middle-income countries. So we found significant policy gaps that need to be addressed, and there is an absence of key policies that really creates barriers for integrated planning across the full suite of transport and urban design features needed for healthy and sustainable cities. So as we see here, many cities did not have policies that are important for health and sustainability. We can see here that cities particularly lacked policies for health impact assessment requirements, street connectivity and information on investment in active and public transport. While not shown on this slide, other key policy gaps across the sample of cities were for things like employment distribution and health-focused national transport policy. Moving on now to policy quality, many cities did not have enough specific and measurable policy targets to support aspirations for health and sustainability. So here we can see the percentage of cities with measurable policy targets for selected measures. Too many policies were stated as general aims or aspirations without those targets to guide implementation and help hold governments accountable. Cities in middle-income countries generally had fewer specific and measurable targets than those in high-income countries. And while Belfast did have complete policy coverage across the indicators, like many other cities, Belfast had few measurable targets to achieve its ambitions. So just to give you some examples of the type of evidence-consistent, specific and measurable policy targets which are really needed for planning healthy and sustainable cities, we can see here that Mexico City has an public open space requirement of a minimum of 12 square metres of public space per inhabitant. And other public open space targets across the city referenced a particular distance to open space from dwellings. And another example here, this time from Auckland, which has a public transport access target that 95% of the population should be within 500 metres of a public transport stop in 2021. We found that most, but certainly not all, policy statements aligned with evidence on health promoting cities. And this is a problem because policies that are not aligned with evidence set up barriers to creating healthy, sustainable cities, particularly when we observe actual targets that are inconsistent with evidence, as cities may lock in unhealthy and unsustainable urban systems. So examples of cities with policy targets that were inconsistent with evidence are listed on this slide. US and Australasian cities tended to be worst in this regard. For example, we saw 3 policy targets inconsistent with evidence in Baltimore and Adelaide, and 2 in Seattle. Unambitious active transport, urban design and density targets, and targets that actively support car use, undermine efforts to increase physical activity, improve air quality and reduce carbon emissions. So we showed the feasibility of systematically assessing evidence-informed policy indicators for diverse cities, and our study really underlines the need to strengthen city planning policies and legislation, and the policy indicators can be really useful for that endeavour by benchmarking and monitoring progress. To help transform our cities for the better, we identified specific policy gaps and limitations that should be remedied in each city, but also importantly policy strengths that should be maintained long term. And comparisons between cities, we hope, can help civil society to advocate for reform and give policymakers the evidence needed to target policy gaps. There is an urgent need to build policy capacity for health-enhancing city planning in low and middle-income countries. And this is a key role of governments in high-resource settings, as well as multilateral organisations such as the World Health Organization and the UN. Low and middle income countries can look to the example of cities such as Sao Paulo, which have relatively high quality policies. To encourage more widespread application of the indicators and informed decision making, we suggest that governments apply these indicators to inform their decisions, particularly in rapidly growing low and middle income countries. There is a need to build the evidence base on healthy cities, particularly derived from low and middle income countries. So overall, we found that we need to see more specific and measurable policy targets to support aspirations for healthy and sustainable cities, but good intentions are not enough. Policies should also be informed by evidence on how to plan healthy cities. And to this end, policy targets need to align with evidence on optimal thresholds for urban design and transport features, such as those identified in the second paper in this series. And with that, I'll now pass over to Professor Esther Serrin from the Mary MacKillop Institute for Health Research at the Australian Catholic University, who will address the question, what thresholds for urban and transport features are required to achieve WHO targets to increase physical activity by 2030?
Thank you, Melanie, for the introduction. We examined thresholds for urban and transport features required to achieve the WHO targets to increase physical activity in the second paper of our series, as Melanie mentioned. Here you can see the title and co-authors of the paper. A physically active population is an essential characteristic of a healthy and sustainable city. Therefore, to inform city planning policy targets, we thought it would be appropriate to determine the thresholds of urban design and transport features required to meet a WHO target of at least 15% reduction in insufficient physical activity. As you know, physical activity encompasses a range of activities, such as sports and gardening. However, a type of physical activity that is particularly influenced by neighborhood features is walking. Therefore, we thought it would make sense to find thresholds that are associated with achieving the WHO targets through walking. By promoting walking, we not only may help increase the number of people that are sufficiently active, but also reduce greenhouse gas emissions and in turn make our cities healthier and more sustainable. So in our second paper, we estimated the minimum thresholds for urban design and transport features associated with WHO target of at least 15% relative reduction in insufficient physical activity through walking. To do that, we used data from 7 high-income and 3 upper-middle-income countries that participated in the International Physical Activity and Environment Network Adult Study, also known as IPEN Adult Study. The dataset included information on participants walking and features of their neighborhoods. Here we defined neighborhoods as 1 kilometer radius areas around the participants' homes. Participants were adults aged 18 to 66 years, recruited from neighborhoods varying in walkability as well as socioeconomic status. To achieve our study aim, we first examined the strength and shape of the associations of 5 neighborhood features that are presented on this slide, with the odds of accumulating at least 150 minutes per week of walking for transport and recreation. We determined our physical activity criterion, that is the target prevalence of meeting the WHO physical activity guidelines via walking, if there was a 15% relative reduction in the observed sample prevalence of not meeting the guidelines. As the observed sample prevalence of meeting the WHO guidelines was 50.4%, the target prevalence, corresponding to a 15% reduction in insufficient physical activity, was 57.9%. So we estimated the values of each of the 5 urban design and transport features that presented in the previous slide, associated with a target prevalence of 57.9% of being sufficiently active. We observed quite large differences in prevalence of meeting the WHO physical activity guidelines across cities. So with samples from the Czech Republic, Denmark, Colombia, and also Wellington, New Zealand, achieving the target prevalence of 58%, while others were falling short by a substantial amount. Population and street intersection densities were curvilinearly related to the probability of accumulating at least 150 minutes per week of walking. Although we must say that the shape of the relation at the higher ends of density was quite uncertain, due to the small number of study participants living in such neighborhoods, and so we couldn't assess accurately the relationship at the higher end of density. As you can see from these graphs, our study suggests that neighborhoods at the lower end of the density continuum would benefit the most from an increase in population intersection densities. As to threshold values, we estimated that living in neighborhoods with at least around 6,500 people per kilometer square and around 120 intersections per kilometer square would be associated with a 58% probability of meeting the WHO guidelines via walking, which was our physical activity criterion. Public transport density and distance to the nearest public park were linearly related to the odds of meeting the WHO physical activity guidelines. So as expected, higher transport density was associated with a higher probability of meeting or being sufficiently active, while a distance to the nearest public park was associated with a lower probability. We did not find the threshold values for these 2 environmental features. This actually suggests that having parks in the immediate vicinity of our homes and having a variety of public transport options nearby can help us meet the WHO physical activity guidelines by walking. It is important to note that the associations and therefore thresholds did not vary by age group, sex, or city. This indicates that they may be generalizable across geographical locations and cultures, at least those included in the IPEN adult study. Let's now have a second look at the relationships of population intersections densities with the probability of meeting the WHO physical activity guidelines via walking. We can see that there is an optimal range of values associated with at least 58% prevalence of meeting the WHO guidelines, which is denoted by the 2-headed arrow panel parallel to the axis on the graphic, as you can see. This basically means that some neighborhoods may be too dense to be optimal for walking, and that there may be an upper threshold of density beyond which the probability of meeting the WHO physical activity guidelines through walking declines. How can we use all these findings in practice? As Melanie has mentioned in her presentation, we can use these and similar findings to inform measurable city planning policy targets. Quantitative thresholds of urban design and transport features are useful for the evaluation of current city planning policies and for guiding their revision. Our work provides support for the feasibility of these thresholds, as a certain percentage of neighborhoods included in our study met these thresholds. Overall, our findings suggest that most neighborhoods included in the IPEN study would benefit from this densification. However, we also need to keep in mind that more is better is not always the most appropriate message, as increases in density in already dense environments may have negative consequences. High-density neighborhoods may attract increased traffic and expose residents to air and noise pollution, which we know are detrimental to health. Therefore, decision makers should carefully consider their local context when planning their city for health and sustainability. We do not consider the thresholds derived in our study as definitive or final. To establish robust and universally applicable thresholds, further international work is needed. And it has to include data from low to middle income countries and cities with higher density. Our study included only 3 upper middle income countries and did not include ultra-dense cities. We did not find differences in associations or thresholds between sexes and age groups. However, our study focused only on adults, while we need to create cities that are healthy for all, including children and older adults, and also healthy for the advantaged and the disadvantaged. As evidence grows, it may be possible to reach consensus on thresholds that are appropriate for various segments of the population and several health outcomes. So there's still a lot to do in this space. After all this work, we also need to make sure that findings are clearly communicated to policymakers who can actually translate evidence-based thresholds into targets for city planning policies. And in this way also support the creation of healthy and sustainable cities. So this is the end of my talk. I now pass the baton to Jeff Boeing from the University of Southern California, who will talk about the third paper of our series and tell us whether dwellers have equal access to health supportive environments in cities.
Thanks, Esther. Thanks, everyone, for being here with us today. So my name is Jeff Boeing, and on behalf of my co-authors, I'll be presenting how we calculated indicators of urban design and transport features for achieving healthy and sustainable cities. So the previous 2 talks have explored whether we have the right policies in place and what the thresholds are that support active living. So I want to begin this talk by thinking about why we should benchmark and monitor urban design and transport features in the first place. So creating healthier and more sustainable cities has become a global priority, integral to achieving the UN Sustainable Development Goals and WHO's health equity goals. But what do healthy and sustainable cities look like? So if you're anything like me, you're probably picturing convenient parking, wide roads, and plenty of cars speeding around. Just kidding. So we're talking about walkable streets, public transit, access to daily living needs, green spaces, and indicators of these kinds of features allow planners to better target interventions, compare between cities for benchmarking, over time for monitoring, to better measure our progress toward urban goals. So that all sounds great, but why don't we then already have this everywhere today? Well, spatial indicators are hard to create, and I'm going to highlight 3 reasons why. So first off, these indicators are needed at both the local neighborhood scale and aggregated to the city scale to allow within and between city analysis. Second, the necessary data do not always exist, and when they do, they may not be publicly available or consistent. Third, advanced spatial analysis takes technical expertise, expensive software, and lots of data. And these are obstacles everywhere, but are particularly so for less resourced cities. In sum, all of this thwarts the creation of consistent, reproducible indicators for healthy and sustainable cities. So we argue that we need a new way forward. And in this project, we leveraged an international network of collaborators for data sourcing and validation of both our inputs and our outputs. And that's particularly important here because we relied heavily on open data, including the global human settlements layer for our urban boundaries, OpenStreetMap for our street network models and amenities, and GTFS feeds for our public transit stops. Once we had gathered that data, we developed open source software to process the data and calculate indicators. And I want to take just a brief technical digression into that software and those indicators here to explain part of what we found. So we define neighborhoods as the area within 1 kilometer walking of sample points that we generated across each urban area's populated areas. Within each of those walkable catchment areas, we estimated population and street intersection density. And for each sample point, we calculated distance to the nearest healthy food market, convenience store, public transit stop, and public open space. And then a sample point was considered to have access to those features if you could walk to them within 500 meters. And that 500 meters is consistent with the UN's SDGs, and it equates to something like a 5-minute walk. Now, once we had calculated all of that, we generated 2 composite indicators. The first is a daily living score, and the second is a local walkability index. The daily living score tells us about local access to a mixture of amenities. And the local walkability index tells us how walkable the neighborhood is. Once we had calculated those, we aggregated all of our sample points up to a 250-meter grid so that we could conduct both within city and between city comparisons. So what did we find? This figure shows the local walkability index. The color scale shows standard deviations with 0 as the global average. Now, this is less of a story about high income versus lower income countries' cities, and it's more about different models of urban planning. Across our study sites, we found that inner cities tended to be more walkable, and outer suburbs were less so. High income cities in Europe tended to perform well, but high income US, Australian, and New Zealand cities tended to perform relatively poorly. So how do we explain this? If you recall from the previous couple of talks, Melanie and her colleagues similarly found that Australian and US cities were the most likely to have policies that favored car use over active transport, and we see that reflected here. In addition, US cities have fallen further behind our modern global goals for public transit access. Sao Paulo and Bangkok offer another interesting tale. So here on the left in Sao Paulo, we can see good performance largely across the city, versus on the right, poorer access in Bangkok outside of the central city. And this also matches Melanie and her colleagues' finding that Bangkok had the greatest policy gaps and limitations, while Sao Paulo's policy framework performed better than even those of many cities in high-income countries. Here we can see access to public open space. This is large public open space of at least 1.5 hectares. Here we have less of a consistent story than what we just saw in walkability. But it is note that 4 of the 5 worst performing cities for access to public open space were in middle income countries, joined by the car-dominated city of Phoenix in the United States. Now, overall, in terms of walkable access to healthy food markets, we find that the European cities tended to score particularly well, and US cities tended to score particularly poorly. And that's highlighted by the 70% of the population that had such access in Bern, whereas only 6% had such access in Phoenix. Second, in terms of population within 500-meter walk to public transit, most cities had at least 60%, but there's an interesting role of informal collective transport here, where we found that 3 cities scored poorly by our measure: Maiduguri, Mexico City, and Chennai, suggesting the role that informal collective transport plays in these cities, but for which data to track them are lacking. And then finally, in terms of access to public open space, we found overall most cities demonstrated high access to any such open space, but we found that there were poor access to large public open spaces, a 10 percentage point drop from any to large. Now, we also examined the population density and intersection density thresholds from Esther's paper that was just presented. And we looked at two scenarios. So scenario A is a 80% or greater probability of walking for transport. And scenario B is the WHO's target of a 15% reduction in insufficient physical activity through walking. And we asked what percent of the population met or exceeded these thresholds. So for scenario A, we found that 61% of the population across these study sites met the threshold, but less than half, just 49% of the population in our high-income countries' cities met that threshold. In terms of street intersection density, we found slightly better performance, about 72% of the population met the threshold. For scenario B, we found that 52% met the threshold for population density, but only, and 59% met the threshold for street intersection density. So you'll notice across these numbers, the numbers vary, but all of them are far below where we would want them to be in an ideal world. So to conclude, our study developed open source software and used open data in conjunction with local collaborators to explore whether cities provide a built environment conducive to healthy and sustainable living. We found that many people lack access to the physical features necessary for healthy and sustainable living today. Open data and open source software have created, for the first time, a new opportunity to both benchmark cities across each other and monitor their progress over time. But importantly, our process begins and ends with local knowledge, from input data collection to output indicator interpretation through our network of collaborators. And that's essential when working internationally and with open data. These tools create a new opportunity now to target evidence-based planning interventions, monitor policy effects, and harness lessons learned from peer cities. And we hope this is just a start. So here we demonstrated the framework and its feasibility, but it requires international effort to continue measuring and monitoring cities. Organizations like the UN and WHO can play a key role here in sustaining this, but so do local, regional, and national governments who can use this framework, involve local populations with crowdsourcing data, fill in gaps, and contribute to the open commons and emerging data platforms. So with that, I'm going to turn it back over to Billy, who will talk a little bit about what comes next and a call to action.
So thank you, Jeff, and I'd like to acknowledge the co-authors of this paper because many of them were new to the series, but they provided us expertise that allowed us to have an expanded view of how city planning affects health. And in the final paper in the series, what we do is summarize the key findings, we consider what next, and we also include a call to action. So since our main primary objective with this series was to answer 5 questions, and we found that by working with local collaborators, it was indeed feasible to measure city planning policies. And this was important because we found that many cities, although they had the ambition to be healthy, sustainable, and or livable, many of them lacked the urban policy targets and standards that would help them to achieve that objective. And this was important because we found that there are thresholds for urban design and transport features that encourage healthy and active lifestyles. And these sorts of thresholds, if we continue to do this sort of research, could inform future standards into the future. We also found that also by working with local collaborators, it was indeed feasible to develop a set of consistent and also validated spatial indicators of health supportive environments. And doing this with open data, which is exciting. We found that the open data was as reliable or even more reliable than some of the routinely collected data. And that was important because it allowed us to identify that there are hidden cities, substantial inequities in cities, in both within cities and between cities, that need to be addressed and when investments are needed. Now, the final thing in the series we wanted to do here was to consider what next. And since the first series was published in 2016, we found that the evidence around city planning and health has grown, and it's growing stronger. There's many more now longitudinal studies that are showing the impacts of city planning decision-making on chronic disease. But we've also found that the evidence on air quality has strengthened. Air pollution is the fourth largest risk factor for global mortality, and there is no safe level of exposure to air pollution, and yet we still design car-centric cities, and many people in the world are living in cities which have hazardous levels of air quality. Another important issue that's arising, of course, is a global trend for an aging population. And as a result of that, we've put in some additional issues into our framework. For example, cognitive health has been added as an emerging priority issue. Urban features and transportation features that we've measured in our series are linked to dementia risk. And so will become increasingly important in the future. But of course, cities are the major generators of emissions, and now are becoming directly impacted by climate change. And so there's an urgency for integrated city planning that will not only mitigate and adapt to climate change, but do it soon. The urgency is now palpable. So the other important issue for city planners that has become very evident during the pandemic is just how important city planning is for human health in the case of a crisis like the pandemic. What the pandemic has done is highlighted many of our cities' vulnerabilities. People who are living in crowded environments which were underserved with services, and those living in buildings that had poor air circulation, and those exposed to more ambient air pollution have been shown to have been more at risk of disease transmission. We saw that as working from home orders grew and restrictions on mobility intensified, many city dwellers who were living in small, inflexible, high-density housing migrated to the suburbs and also to regional cities, and that put pressure on amenities in those regions and also housing affordability. And yet we also found some good news. People who were living in amenity-rich areas with access to shops, services and public open space, they appeared to do better during the pandemic, particularly those who were fortunate to work from home, and that was restricted probably to the higher socioeconomic groups. And we saw some exciting, rapid health supportive transformations. We saw telecommuting, which has often been difficult to achieve, but now suddenly with the pandemic, more people were telecommuting. We saw more road space allocated to walking, to cycling, to commerce and to recreation. And we saw a proliferation of pop-up bicycle lanes across the world, which was enabled people to cycle safely. But perhaps one of the most exciting developments was the C40, the network of mayors of megacities, decided to commit to building back better post-pandemic and to create 15-minute cities that would ensure that people have access to all the amenities they need for daily living within a 15-minute walk or cycle from their home, with the aim of reducing inequities in cities, improving public health, but also tackling climate change. Now, in the first series, I talked you through this framework of the direct and indirect pathways through which city planning affects human health, and it incorporated the 8 Ds, these urban and transport design features that we've included in our second series. And the idea of this was to create and deliver a compact city which is essentially the 15-minute city. But what we've done in the second series is taken this a step further in asking the question, what next for city planning? What we wanted to do here was to focus on how can we optimize the 15-minute compact city to protect not only humans, but also ecosystem and planetary health. So we've expanded our framework of the direct and the indirect pathways through which city planning affects not only human health, but ecosystem health and planetary health. And we've suggested that the need for not 8, but 11 urban system policies that would create 11 urban and transport planning interventions, up from 8 Ds to the 11 Ds. And I want to talk you through the rationale for why this is important. So in the first series, we did focus on housing. We said, of course, it was a critical urban system that needed to be addressed. But of course, in the pandemic and with climate change, we've found that there's taking housing to a whole new level of concern. We found that people who were we found that in the first series that what we emphasised was the importance of high density housing located in walkable neighbourhoods with access to good urban design, and that this would encourage walking, cycling, public transport use, and this would impact on individual risk factors for chronic disease outcomes. So housing is still important. But in the pandemic, what we've seen is that not only is it important that people have access to those amenities, but they need to have access to affordable and decent housing, appropriate housing for the purpose. And this is because we found that city dwellers that were living in crowded houses in underserved communities were at greater risk of disease transmission during the pandemic. And those living in poorly designed, high-density housing with insufficient and inflexible space were at significant risk of mental health problems when the work from home orders were enforced, and also mobility outside the home was restricted. So housing has become even more important, and we've suggested the need for urban housing design standards that would improve the quality of a housing stock. But in the second series, we wanted to also focus on the ecosystem. How can we protect the ecosystem, which is under threat on multiple levels? And in particular, we wanted to focus on biodiversity loss. Urban expansion is occurring at twice the rate of urban population growth, and this is threatening biodiversity. And so what we've proposed in our framework is the need for nature-based solutions and urban greening that can be used, for example, as a disaster mitigation strategy for stormwater management. It can be used to cool neighbourhoods by increasing urban greening, and this would reduce heat island effects and also result in reducing emissions in cities from household energy use for cooling. So nature-based solutions are really important for considering biodiversity sensitive design principles, which we could be incorporating into future urban development to protect biodiversity, and at the same time enhancing the desirability of neighbourhoods by ensuring that there is green, leafy and biodiverse urban development in our cities. Now, we've emphasised the importance of air pollution in this series, noting that it's the fourth leading risk factor for global mortality. And if we're concerned about the downstream impacts of air pollution on human health and on greenhouse gas emissions, we really need to be thinking upstream of the availability of comprehensive, enforceable air quality policies upstream that will ensure that people are living in neighbourhoods with urban design features that foster a sustainable mobility, that also have demand management, that reduce the demand for driving by providing good public transport, but also restrict where and at what speeds cars can travel and are permitted to travel through urban developments and urban design. But none of this is possible, of course, unless we have good governance in our cities. And we've added into our framework the need for good and integrated governance. We've talked about the need for horizontal integration of all these urban systems upstream of all these systems that we've described, but also the vertical integration between different levels of government, between national governments, regional governments and local governments, but also involving the private sector, civil society and the community. So that's been embedded now, good and integrated governance into our framework. And we've also highlighted the importance of distributed. We've identified as the 11th D in our framework. So we've identified that there are substantial inequities in cities and that in terms of the distribution of health supportive environments. And if we want to have equitable cities, we need to ensure that everyone has access to these. So distributed is the 11th D in our series. Now, it was important to have a call to action given the size of the agenda and a whole society approach. Now, we've demonstrated that it's possible to create a global system of comparable policy and spatial indicators, these upstream determinants of health, and we call on global agencies, national, regional and local governments to use and recommend the tools that we've created to develop these indicators in other cities around the world and to replicate them to benchmark and monitor over time. We'd like to see the tools expanded to include indicators that we have included as the pathways in our new framework. Levels of traffic, green canopy, heat island effects, levels of crime. These are all additional indicators that could be developed and included in a global tool for benchmarking and monitoring cities. We've emphasised the importance of transforming urban governance, that we need horizontal integration of all these urban systems across government, but we also need vertical integration between different levels of government with the private sector and the community and civil society. And we've also noted, as you've seen, that there's a need to strengthen our policy frameworks to have evidence-based thresholds for interventions, and we could expand these to include the 11th D. So we need to use evidence to inform those standards, and we need to monitor implementation. Policy is only as good as its implementation, and we need to monitor over time how well we're doing. We've emphasised also the importance of high-income countries and global agencies working with low and middle-income countries to both support them in their transition as their cities are rapidly urbanising, but to support them in the event of climate events, which we're seeing increasingly, which are affecting disadvantaged communities across the globe. Now, the final call to action is to civil society, citizens and the research community. We've shown how important it is to have access to open data, and we'd like more citizens to jump on board to help us create and also to use this open data. We want to encourage citizen science program, and that could be by global agencies, national governments, state governments, to encourage people to collect data, particularly in the low and middle income countries where data was less available and just is an emerging area. We always talk about the need for evidence-based policy, but if we want evidence-based policy, we need to have policy-relevant and practice-relevant evidence, and this can only be achieved by academics, policymakers and practitioners working together to co-design research. And finally, we have a job for our funders. We want to thank our funders for the incredible support they've given us in supporting each of the researchers who have contributed to this study. But what we want to emphasise is just how important it is to have multi-sector, multi-outcome, multi-country studies of this nature. And we would encourage more of this type of research, and we would also encourage the reviewers of grants to prioritise this when they're looking at this. This is the way we'll advance and inform our future planning agendas. Now, most importantly, what we want to do with the cities that have been involved in this study to use our evidence that we've created, and to talk us through about how cities can find out whether their city is healthy and sustainable. I'd like to introduce Carl Higgs. He's a data scientist at the Healthy Livable Cities Lab at RMIT University, and he will present to you about where people can access this data.
Thank you, Billy. Good morning. I'm going to be introducing the reports we've prepared for summarising policy and spatial indicator insights for each city in our study. To help make our findings accessible, we created a suite of reports for each city and in multiple languages. These have been designed to communicate our findings for local audiences whose lived experiences are shaped through their city's transport and urban design features, and to empower decision makers with the high-level information needed to enact change. They provide a local lens for viewing the results of the Lancet Global Health series on urban design, transport and health, concisely summarising the series' core concepts, and provide executive summaries for each city. We engaged with, I've got a bit of lag in the slides there, excuse me while I just catch up with where I engaged with local collaborating on the translation and contextual of the reports. This has resulted in 46 bespoke reports for each of the 25 cities from middle and high income countries included in the study across 16 languages: Catalan, traditional and simplified Chinese, Czech, Danish, Dutch, German, Hausa, Maori, Spanish including Mexican Spanish, Portuguese including Brazilian Portuguese, Tamil, Thai and Vietnamese, in addition to the English language versions created for all cities. To support this process, we authored open source software which allowed for flexible customization of the report layout and adapting the plots, formats and units according to the norms of the cities studied. So this means the process can be extended for new cities and languages to produce new reports as we or others extend the study further. The included figures enable performance comparisons to be made with the median values for the 25 international cities in terms of population access to urban design and transport features, and the overall presence and quality of city planning policies that promote health and sustainability. The reports also provide more detailed overviews of the spatial distribution of urban design and transport features to help identify areas that could benefit the most from interventions to create healthy and sustainable environments, such as walkability relative to the 25 cities studied, the percentage of population meeting minimum thresholds of population and street intersection densities to support reaching the World Health Organization's Global Action Plan for Physical Activity targets. Maps to identify neighbourhoods with nearby access to well-serviced public transport and large public open space, as well as summaries of the overall percentage of population who live in these neighbourhoods. And a series of policy checklists detail further insights that could inform changes needed for local city policies. The City Planning Requirements Checklist identifies whether a series of policies for achieving healthy and sustainable cities were identifiable, with a summary of the percentage of cities meeting these objectives with the city study from middle and high-income countries. And city-specific checklists for walkability policy, public transport policy, and public open space policy help to identify whether policies were identified, reference specific standards, featured measurable targets, and whether they can be considered consistent with evidence for environments supporting healthy and sustainable cities. We'd like to express our gratitude to those who assisted with translations and the local experts who assisted with applying our methods to the diverse cities studied. These reports will be disseminated through the Global Observatory of Healthy and Sustainable Cities, which my colleague, Professor Deborah Salvo of Washington University, will now introduce, along with the 1000 Cities Challenge. Thank you, Deborah.
Thank you very much for the introduction, Carl, and thank you all for having me here today. It's a pleasure to be here. So today, in addition to celebrating the launch of this new series in the Lancet Global Health, composing the 5 papers of which you've heard about from my colleagues, we are also very excited to formally and officially launch the Global Observatory of Healthy and Sustainable Cities. This observatory is hosted in a website, which you're seeing the link for on your screen. And it includes downloadable, free scorecards and report data for the 25 cities. So the reports that Carl talked about, as well as scorecards, which I'll present you an example of in the next slide. And on this website, you will also find access to our open source code, as well as the tools and protocols that we used throughout this study. So here's an example of one of the scorecards. So in addition to the extended reports for each of the 25 cities, we went ahead and designed scorecards, which are essentially single-page, easy-to-understand infographics, which summarize the main findings in terms of the spatial indicators and policy indicators for each of the cities. So in this example for Mexico City, my hometown, you can see, for instance, that in the top part, you see the spatial indicators. So you can see that in Mexico City, 49.6% of the population has access to any public open space. On the bottom part, you can find the policy indicators, and we show with 3 easy to understand icons whether there's a policy that exists for the given indicator, whether the policy aligns with the promotion of health and sustainability, and whether the policy has measurable targets. So for instance, again, for Mexico City has parking restrictions to discourage car use, and this is well aligned with the promotion of health and sustainability. However, this specific policy doesn't have measurable targets, so there's still room for improvement. We hope that these scorecards can help disseminate the work and the evidence-based thresholds and the work applied to local settings around the world, and help with advocacy efforts to promote the creation of healthy neighborhoods and healthy cities across the world. Our goal with the observatory is to provide comparable evidence-based spatial and policy indicator data of healthy and sustainable urban design and planning for cities across the globe. We do hope that with this effort, we are motivating cities across the world and countries across the world to start their own urban surveillance systems, and essentially to create a system where cities can have some goals in mind and track their progress towards these goals. Indeed, our observatory was inspired by another very successful observatory in our field, the Global Observatory for Physical Activity, GOPA, which has been very successful in bringing evidence-based indicators towards policy action. Our guiding principles are to continue to use open data and open science, to foster interdisciplinary team science, to keep using global data for local impact. And we are especially highly committed to building capacity and fostering equitable international collaborations. So we're not interested in being a team of researchers from high-income countries doing work around the world, but in really integrating people from across the world with different sources of expertise and bringing them all together. We have a very bold vision, which is to grow our observatory so that it can include additional indicators and comparable data for over 1,000 global cities. So this is just the start. For this purpose, we are very excited to invite you all to join us in the 1,000 Cities Challenge. In particular, we are looking for geospatial data scientists, for policymakers, for citizen scientists, for urban health specialists, you name it, anyone that's interested in helping us gather data from your own cities using our open source code and tools available through our website to create your own indicators for your cities and to help us build this observatory into what it should be, the 1,000 Cities Challenge. Thank you very much. And now it's my pleasure to reintroduce my colleague, Esther Sarin, who will guide us in a panel discussion.
Thank you, Deborah. We're trying to get the panel, everybody back. So today we have with us 3 distinguished panelists. Our first panelist is Felix John. He is the first Chennai city bicycle mayor. Just to provide some context for the audience, I will say that the Bicycle Mayor Network is a global NGO guided by the belief that bicycles transform cities and cities transform the world. And we couldn't agree more with them. Sorry. Our second panelist is Mrs. Joanna Frank. She's the president CEO of the Center for Active Design in New York, where she advances design and development practices to foster healthy and engaged communities. And our third panelist is Dr. Fiona Bull, who's the head of physical activity at the World Health Organization headquarters in Geneva. Welcome, everybody, and thank you for joining us. I will start with a question for our first panelist, Mrs. Felix John. Felix, so the Cycling Mayor's agenda is to increase cycling by 50% by 2030, right? So how does this series help your organization with this agenda?
Hi, everyone. Thanks for having me here. And it's a pleasure to listen to all this policy and ideas that's coming out of international community. Well, the agenda for our bikes NGO is basically to achieve the target of 50% of city trips by bicycle before 2030. It's an ambitious one, but I think for that to happen, I have 4 things as a pillar, which is the community, the infrastructure, the policy, and the law. And the community is the civil society and the citizens of the city itself. And policy plays a very important role, and it has to be a people-centric policy. As of now, we have a very car-friendly or motor vehicle-friendly policies that support all their ambitions, but Chennai is already lagging behind in many aspects when compared to the Western nations, and we wanted to be more proactive in terms of becoming sustainable. And I believe we have the potential to become also the cycling capital of the East. Again, an ambitious goal for me. Yeah, and we try in all ways and manners to promote active mobility that includes cycling and walking across the city. And this challenge of 1,000 cities across the globe is going to support the stakeholders of the city, because I'm going to take it forward with the city stakeholders to discuss it further and to see how we can come up with cycling and walking friendly policies that supports an active environment within the city. And I'm very happy to be part of it. Thank you once again.
Thank you. Thank you very much, Felix. I think my camera seems to be frozen, but I'm behind it. I'm still here. we'll move on with the second panelist, Joanna. We have a question for you as well, which is very similar to the first one, but in the context of your organization. So what does this Lancet Global Health Series offer to an organization such as the Center for Active Design, which has a mission of promoting architecture and urban planning solutions to improve public health, please?
Sure, thank you. And I agree, it's been fantastic to hear everybody presenting today. All of this research, all of these discoveries really work directly with what we are trying to achieve, which is really how do we bring about complete market transformation of the built environment so that health is always part of the consideration when you're designing, when you're planning, when you're building, when you're investing in our cities. And none of that is possible without the research, such as the research that is featured in the Lancet's Global Health Series. In particular, the solutions offered throughout the second Urban Design, Transport and Health Series will really help to push our efforts forward because we, along with others, are really looking at how do we set metrics by which everybody is held accountable, everybody is able to compare, and obviously this is the work that is featured throughout this research. So there is a real push at the moment globally, especially coming from global investors, institutional investors, to really understand and quantify the impact that promoting health has throughout our cities with a real eye to equity as well. And it's, I think one of the things that COVID has done for us is really increased demand for healthy cities in a way that we really haven't seen in the couple of decades that we've been working in this space. And what that means is that there is now political will to promote health. And because of work such as has been talked about today, there are solutions. We know what to do. We know what to do because of this research, and now there is demand to do that in a way that we've never seen before. It isn't possible to do this unless we understand, what are the indicators, what are the research, what are research-based policies, what are the metrics that measure success. So our role as translator, which is what we are, we sit between research community and those who are building our built environment on both the public and the private side. It isn't possible without the work, without the research that is disseminated by the Lancet. So thank you to this series. Your work is constantly evolving and informing our work. And in that way, we're able to really respond to the demand that we're now seeing across the world. We're working in 40 countries, and we're seeing similar trends in all of them, in that demand has really increased because of COVID.
Excellent, Joanna. It's really great to see that our series can actually contribute to your work, and we're very excited about this and hope that this is going to continue on. Fiona, so I have a question for you. We launched our collaboration for this series in 2018. At the same conference, you launched the WHO strategy to decrease physical inactivity by 15% by 2030, and we used it in our threshold work. So, as head of physical activity at the WHO, how would you respond to the findings that cities are falling well below the thresholds for urban design interventions that we need to achieve this goal in particular?
Well, thank you. Thank you very much. Thank you for the invitation to join this. And let me first congratulate the leadership and all the collaborators around the world, in all the cities, in all the disciplines and all the countries. It's quite an astonishing and impressive group, and your results and the launch today of this Lancet series is going to be extremely important and extremely useful to us. Now, your question, Esther, is what do I think of the results that some fall well below? Well, it's not surprising. We are aware of the global levels of physical activity and we're tracking those, and they're falling well short of what would be beneficial for health in many countries. Your own data show this, of course. And so what are the causes? Well, we know one major area is the underpinning motivation for your projects, and that is the urban design. So what I found particularly interesting, though, over and above, of course, the important demonstration that we can do the sorts of measures that you have demonstrated in both policy and then the spatial measures, is in fact that the policies aren't there. And so for WHO, which is a technical agency and evidence-based,
We need to know what is needed, and we need to know how to measure, and then how to support countries develop those, implement those, and evaluate those. And you've really covered across all of those. So it didn't surprise me that many. It surprised me a little bit, some of the European countries falling shorter in some areas than I expected. But the differences you found, and with your comparable measures, highlighted those differences between countries, show how important it is to start measuring. And I think that's one of the take-homes, is we need to start measuring, and you've made a substantial contribution into the tools and the demonstration of its feasibility.
Thank you very much, Fiona. That's great to see and to hear that you find this useful for your agenda as well. We were surprised as well, I must say, to see that some of the European cities were falling short as well of the threshold. But here we go. So I would like to continue on this discussion with a question for you all. What is your reaction to our recommendation that cities develop policy and spatial indicators that measure the upstream determinants of health and well-being in cities? Well, can we go back to Felix? What do you think?
I think it's very important for a city, especially after the COVID. We have to differentiate before, post-COVID, and the pre-COVID. So the health is an important factor now, and how a healthy lifestyle is going to contribute for the healthcare system is also very important. And planning comes in place for taking active mobility as a priority. And I think, yeah, it's important aspect for a city and its well-being.
Thank you, Felix. And Joanna, what's your view?
Sorry, trouble with unmuting. Yeah, I mean, I think we go back to this kind of measuring piece and really looking at, how do we break down silos? How do we bring people into these conversations? I think folks don't know what to measure because we haven't been shown indicators that really make sense to what they are trying to achieve. I think it's really important to understand that cities and elected officials within cities aren't always going out to promote the health of their population. I think it's really important that we show the benefits in all of their kind of upstream and downstream, but really to show the co-benefits of having a healthy city and how that aligns with other political agendas, financial agendas, and so on. So I think that we all who are really passionate about promoting health within our built environment have become very sophisticated in understanding, and this report continues to do that, evolving our understanding of what are the co-benefits of having a healthy population. Whenever you're measuring them, really understanding how that aligns with other key goals of a city helps us to really get the traction that we need in order for people to be always thinking about our built environment is impacting health, whether we know it or not, whether you know it or not, and then how do you measure it? So I think for me, it's always measure at every point is important because it's going to give you different information.
Thank you, Joanna. And Fiona, I think, I guess upstream determinants of health are very much the agenda of the WHO, aren't they? So,
well, of course they are. And I think, of course, WHO has been tracking health, the consequences, the diseases and the risk factors, but less so the environment. So I think it's absolutely fundamental that we start looking upstream and start measuring those causal factors, the correlates, so we can understand. And as Joanna's just said, we need to know what to intervene on, and we need to be able to measure it and track it. And so I think we're seeing an absolute shift as Billy's introduction and the presenters have shown. We have built a very strong basis of evidence about the factors that are important, but we do need to now know the thresholds of those and have the tools to measure them. And so I think it's vital. It's the evolution of this field. It's coming to a very important point. And I hear your call very clearly, and I hope people respond to it, that we still need to build that evidence and demonstrate the upstream measures and the feasibility in more lower and low income countries and more diverse cities. But this is a very promising direction, and it's absolutely where WHO is going. I mean, the confluence, as Joanna was just mentioning, not just for the Global Action Plan on Physical Activity, but thinking about the decade of action on healthy aging, the decade of action on road safety, and of course the agendas which we have towards the Sustainable Development Goals. So there's going to be many users of these to see them for their different agendas, but actually we all need to be measuring in the same way that some of those key components, and this is making a contribution to that.
Thank you very much. And so I think we've got time for another question, and that's going to be, what is your one take-out message from this series that you would like cities to act upon, and is there anything else we should try to do? Felix, back to you.
Make policies, measurable targets, make the cities more friendly for walking and cycling. I promote the cycling, so I'm in most favor of the cycling for the most of the part, and it cuts short most of the travel time, and it's more active, and walking among the neighborhoods has to be encouraged and inculcated mostly. Yeah, that's the takeaway for me.
Thank you. And probably we should actually study also thresholds related to cycling. The ones that we've actually published in this series are specifically related to walking, given that most people actually engage in walking. Joanna, yes, your take-out message.
Sure, absolutely. So I think it's a theme that it runs throughout the work that you've been doing, and that is having an integrated approach to planning that is really breaking down silos. There are still silos, having worked in cities, having worked across the private sector as well. It is incredible how silos, you think you've broken them down and they reappear. I think one of the things that this report has done and that we all need to consistently do is really look at defining the co-benefits as they align between promoting public health and planetary health, that these two subjects cannot be divided. And we do see that happening. We see people saying, oh, I'm promoting health, so I don't need to worry about sustainability, or vice versa, right? So I think it's really important for all of us who are working in this field really to always make that kind of argument about the co-benefit, which is, of course, what you have been doing as well. So breaking down silos, I feel like we've been saying it for forever, but we still need to continue to do so. So that's a big takeaway for us.
Thank you, Joanna. And finally, Fiona, yes.
Thank you. Well, I think my takeaway is some of the early results presented in the first and second papers, and that is that firstly, the policies, we need more of them. There are countries and cities with the absence of key content in their policies. And so I think that's a very important learning that we at WHO can take forward to continue to build and encourage and guide countries and cities to create those policies. But also it was interesting that there was actually barriers within those, so the inconsistency within those policies. And I heard a takeaway is the need for capacity building. So that clearly the learnings that you've got are going to need to get into them, reach all of the decision makers and those who can influence them. So there's going to be a really big challenge and need for the capacity building. Meanwhile, we want to see more of your evidence-based thresholds, but still we can start working on improving policy so those thresholds have got a home when they get finalised and brought forward.
Thank you very much, Fiona. So thank you very much all for sharing your views, insightful thoughts with all of us. I'm sure the audience appreciated hearing your views very much as we did. So we would love to continue our conversation with you, but however, we have to leave some time for the audience to ask us very difficult questions. We will now move to the Q&A session that will be facilitated by Jeff. Over to you, Jeff. Thank you.
Thanks, Esther. And thank you to all the panelists for that fantastic conversation. So I'm going to facilitate Q&A for a few minutes here. I've been collecting questions that you've been typing in over the past hour. For our first and most important question, I'm going to pass this on to Zoe. Zoe, will this presentation be recorded to watch later?
Yes, that's true. It will be recorded. So I think one of my colleagues has put the Lancet Global Health hub page web address in the announcements box, and it will be available there probably by the end of the week. We'll also be doing another version of this, so people could also watch at a different time zone on 2 p.m. on Thursday. And it will also be available in the Bright Talk platform. So yes, plenty of opportunities to see it again.
Thank you. So we also got a couple of questions here about the website for the scorecards and how to get involved. So I'll just tackle that quickly. It appears in your announcement box. If you look at the right panel, you can pull that up. But just for reference, if you didn't see that, the URL is healthysustainablecities.org. That's www.healthysustainablecities.org. Okay, so let's move on to a bit of a meatier question. So Billy, I think you'd probably be well equipped to tackle this one. So one person asked, how can we create healthy, walkable environments when most of Melbourne urban cities are divided by motorways, freeways, where the noise is unbearable? Most of the parks, walk and cycle scooter paths are around these motorways and freeways. Many residential subdivisions are now very close or abut these freeways. That's a great question, right? Because so many of our cities are infused with automobility and roads. So what do we need to focus on to start transforming those into healthy environments?
Yeah, I think what we've shown very clearly here that Australian, New Zealand and American cities have got a lot to learn about how we could do this better. And I think a starting point is for any new development. For example, in Melbourne, as we've just mentioned, Melbourne is growing at a very rapid rate. I mean, there's been a hiccup now because of COVID, but no doubt it'll get back to be the rapid growth that it's experiencing. And we need to make sure that any new development is healthy and sustainable. And fortunately, we're going to be talking about the launch of the Melbourne results immediately after this session. But we are talking, it's terrific that the Victorian Planning Authority has put out guidelines which are evidence-based to try and achieve that. The density targets are not high enough in my view, but apart from that. So that's one way, getting the new development right. And then it's retrofitting. And to be honest, and that's what's really critical here for the lower middle income countries, retrofitting is really expensive and it's very difficult. We can do our best. And so the starting point in Melbourne, for example, is to be around the activity centres, that there are activity centres. How can we retrofit those to become part of in Melbourne, we have the 20-minute neighbourhood rather than the 15-minute city, but it's the same sort of concept where everyone would have access to amenities within 20-minute or 10-minute walk either way. So 20 minutes is actually 10 minutes there, 10 minutes back. So I think what we need to do is that's the way we can tackle that. We need to tackle the activity centres to try and retrofit those to become to create these walkable catchments. But it's quite difficult when you've got an established city. I take my hat off to people who are trying to do that, but I recognise it's not easy. But the sorts of things we've got in our series can give some clues about what's needed to be able to transform cities.
Thanks, Billy. That was great. So I'm going to kick the next question over to both Melanie and Carl, taking advantage of the fact that they're co-located right now. We had a couple questions along this theme. So what are some alternative strategies for cities with a low economic climate who maybe can't implement some of these best practices? And Melanie, given your work in the policy space, I'm curious what you think about lower middle income country cities' ability to enact some of these best practices. And Carl, similarly, we had a question along those lines of how can those kinds of cities increase their capacity in urban planning data systems? So both urban policy, but also being able to contribute on the data side to these kind of indicators.
Yeah, I think it's really important to acknowledge that the low and middle income countries have fewer financial resources to do the sort of planning that we are discussing. but also to acknowledge that low and middle income countries do have some real strengths. So, for example, in Jeff's paper, acknowledging that access to walkable environments in many middle income cities in our sample was actually quite good. So I think that's the first thing, but also this is where our study comes in. We're trying to build partnerships between low and middle income countries and research so that we can, from the research side, build the evidence base and also the indicators that are really policy relevant to point to specific areas and priorities that could be improved in policy. So where we see policy gaps, so an absence of policy or issues with perhaps poorer quality policy, we can point to specific actions. So rather than just this sort of global, oh, you need to improve, we can be quite focused in recommendations. But I also, in our paper, we are very careful to suggest that it's for high resource countries and also multilateral organisations to step into this space and to provide that leadership and guidance to help build that policy capacity in lower resource settings.
So in terms of the data question and contributing and accessing open data, it's an interesting space. Obviously, we all know that over the past 20 years, this whole movement around community contributed data has really taken off. But there's a lot of fragmentation in it still. For our project, we drew upon OpenStreetMap, which is a fantastic resource, but it's not equally contributed to from all around the world. For example, for Maiduguri, in a city in our study from Nigeria, we ended up using custom data that was collected by our collaborators there, because there was a lot of hard infrastructure, but not a lot of local amenity represented on OpenStreetMap. But having said that, there are community organisations around the world, local community groups for contributing to OpenStreetMap. I think one of the challenges is perhaps it's not inherently English language, but it's I suppose that is a barrier. A lot of the documentation and engagement with it is in English, but you can actually tag features in other languages, and we through our local collaborator process, we aim to pick up on local context specific tags. When I say tag, this is how you code information for a local area. It might be a point or area of interest, and there are certain values that are attributed to it, like it's a amenity or a shop is a supermarket. It's the way you can locate information. But likewise, it could be a tortilleria in Mexico City was one example of a place that people go to for fresh food. So I think being aware that there are local opportunities for contributing to open data, but also when you engage in a kind of a global an outlet with global scope like OpenStreetMap, it gives opportunities for people outside your local context to then access that, which is so powerful. It's a broad community, so I think that's a particularly good one. I'll leave some space for someone else to talk now, though.
Thanks, Colin. So I have a question for Esther next. Esther, I think this one is probably regarding the curvilinear relationships that you identified for those thresholds, where perhaps a certain level of density can become too dense. Which were the densest cities that were included in the threshold study? Do you recall which places may have exceeded ideal density?
Well, I think if I remember well, it was Bogota, Colombia, mainly in relation to the scenario B, which is thresholds related to a reduction of physical inactivity. That was the city where we actually found several neighborhoods exceeding the thresholds. As I said, we didn't really have ultra-dense cities in our study, so I think we probably would have had something similar if we had included Hong Kong in the study. So the only one that I can say that exceeded the thresholds was Bogota for that particular physical activity criterion. We had a couple of other cities, and I think it was Cuernavaca, Mexico, that exceeded the thresholds for the other criterion we had, which was having a prevalence of walking for transportation of 80%. So that's my answer. Yeah.
Thanks, Esther. So I know we're right at time, but it looks like we might be able to squeeze in a couple more minutes here. I wanted to throw the last question back to you again, Billy. This is kind of a broad one, but I'm curious what you think. So how are cities receptive toward health and sustainability through transport? So I guess on paper, all of this is all well and good, but how receptive are cities to change, especially this kind of change? And what can we do to make them more so?
I think actually it was a good question to put to Melanie, because what we found in the analysis of the policies is that there is a lot of aspiration to be healthy, sustainable, and or livable. So aspiration is not the problem. I think people recognize we have a climate emergency. We need to act. We need to act now. That's a co-benefit for health. If we can act on all of these, bring these benefits together, it would really help. The problem is that we don't have measurable targets and standards to achieve the ambition that cities have. And that's, I think, the strength of this study and why it was so important to look at those policies. It's not that people don't want to do good. It's just that they don't have the policies in place to do it. It's not enough to say, oh, we want to create walkable neighbourhoods. We want to create walkable neighbourhoods, but how? And so that's what we're hoping to achieve with this study, is to try and show some of these metrics, which is what we've achieved through Esther's work, so that we can actually start to look at, well, what do you need to change in order to get there? So I think there is a lot of aspiration there. I think cities do want to change. The question is how to go about that. And what we're trying to do now is stop telling people what they ought to do, to try and give them evidence about how to make those changes that will actually produce the results that we all know what we need for the future.
Thank you. And on that optimistic note, I think we're going to wrap the Q&A, and I'd like to turn it over to Zoe for some final closing thoughts.
Trying to unmute my mic.
You're unmuted.
I'm unmuted now. Sorry, everyone, for the delay. I don't know what was happening there. But thank you. Set of presentations. Am I back?
Yes, you are now.
Sorry. Thank you. Yes, there was an awful lot to digest there. So I do encourage you to go and actually read the papers. As I mentioned at the beginning, the hub page is there in your own announcements box. And really to digest them, to get involved, to go and look at the 1,000 Cities Challenge, and give us your feedback. So I'll leave it there. I want to thank all the presenters for running us through what was years of work in 10 minutes. Thank you very much indeed. Thank you to our panelists for coming along and giving us that external context. We're really pleased to see that the work you feel has value going forward. And thank you to our technical team for helping us to run it. So thank you everybody for listening. I'm sorry if we didn't get to all the questions. I hope you enjoy the rest of your day. Goodbye for now.
Bye for everyone.